Hi everyone, it's Beth Engelman from Chicago, and today we're talking about the Affordable Health Care Act, or Obamacare, and why I am opposed to it, and I hope the Supreme Court shuts it down. I don't think we should be forced into buying something, especially something private, and I have to tell you, I've been dealing with the health insurance companies since Jackson was born, and I can't stand them, and I can only imagine now there's going to be even more red tape. When you think about society and we think about mandates, I think it's for the betterment of society. For example, education or Social Security, helping our elderly. I think that's really important. But I don't think having to buy insurance is really making society better. Maybe making healthcare more affordable, and maybe making more free clinics or more subsidized clinics for those people who need it and can't afford healthcare. But I think forcing people to have to buy insurance, especially insurance that has certain parameters, whether you believe in birth control or not, I don't think people should have to be forced to do it. And then that sort of brings me to another issue, which is I don't think as a society we should be paying for people's bad decisions. For example, my mother was like the most amazing woman ever, but she made some really bad decisions. Namely, she smoked. And my mom would be the person in the hospital with the oxygen tubes in her nose smoking. And she paid for it dearly. She paid with her life, and it was expensive. And God loved my dad. He was the ex-husband. He paid for it. But my mom would have been the first one to say this was her bad decision. It was her choice. It was her burden to pay, or my dad's. But she wouldn't have wanted someone down the street or the government, or worse, even Jackson, my little guy, paying for her bad decisions. I want to see the middle class back to work. I want to see more jobs. I want to see small businesses thrive. And I'm very, very concerned about these small businesses having to now foot the bill of health insurance for their employees if they have 50 or more employees, or they're going to be fined, because I can't imagine that's going to help them grow in the areas where they can then hire more people. And I think that there's ways of offering tax incentives for health insurance. I feel like there's ways that we can maybe have people, maybe at the state level, pool resources together so that there is affordable health insurance, but it's something that should be done at the state level and certainly not at the federal level, where you know there's going to be like 5 million layers of red tape.
I myself am pro healthcare reform. If you've watched any of these videos that I've made, I know you're shocked. Although I confess that the mandate, which states that everybody must purchase healthcare insurance of some kind, has me a little conflicted. Some people simply cannot afford it. And I'm not just talking like tighten your belts, it would be tough, but we can do it. So that part of the healthcare reform really has me conflicted. I've read the bill, I've read it from start to finish, and I've listened to so many arguments, and I'm still no clearer on how I feel about that. The strongest reason that I am staunch pro healthcare reform is our children. In particular, the pre-existing conditions that this now, what is it, like 60 million children will no longer be denied care due to pre-existing conditions. My 9-month-old would be one of those babies. He suffered a seizure Christmas Eve, 3 seizures in a row, and had to have an EEG, had to go to the emergency room, spent days in the hospital. It was terrifying. MRI ordered, the whole 9 yards. And although all of his stuff came back normal, he would then be denied any sort of neuro coverage for the rest of his life simply because he had an infantile seizure. And so, for me, personally vested, for me, that is a main reason for supporting healthcare reform. The other is that I used to work in a doctor's office and handled a lot of the insurance and the billing. And I don't know if you've ever looked at your EOB, which is an explanation of benefits. You'll see what the doctor or hospital billed the insurance and what you would be billed. And then you'll see what the insurance pays. And it is frequently a great deal less? How should Joe Schmo, who doesn't have any insurance, be financially ruined because of a broken leg when the insurance can pay next to nothing? And it's true, the insurance is going to send, they have a mutually beneficial, a business arrangement between the two of them, and so it behooves the insurance and the doctor to settle for a smaller amount. But that's not fair. So, again, I am definitely pro healthcare reform. Am I conflicted on certain parts of it? Yeah, I am. That being said, I don't mind paying for you to have healthcare. I would hope you wouldn't mind paying for me. We all put our money in this big giant pot, and that's how we take care of one another here in America. There seems to be a lot of push forward and an almost equal push back with what's happening. Just crazy. Crazy time.